It's Women's Health Wednesday, and while many associate lung cancer primarily with men or smoking, the reality is that it affects thousands of women each year, including some who've never smoked. Bringing her clinical insight is Heather Franklin, a nurse oncology practitioner. In our sit-down conversation, she explains the latest findings in lung cancer prevention, detection, and treatment. How common is lung cancer in women?
Lung cancer is pretty common in women. I know that statistics are talking that diagnosis or patients diagnosed with lung cancer under the age of 65, they're actually seeing more women of that age group being diagnosed over men.
Are there any major differences in women that have lung cancer and men when it comes to detection?
No, not necessarily. We're finding, I think lung cancer is seen as like a smoker's, type of cancer. We're seeing more and more people. I think it's upwards of more than 20% of patients diagnosed with lung cancer who have never been smokers. They present normally pretty much the same. A lot of times lung cancer is found accidentally.
And speaking of how it presents itself, what are some symptoms people should be aware of?
They're really vague symptoms. Sometimes it's, prolonged coughing. Obviously, the worrisome symptoms are unexplained weight loss, coughing up blood. But many times our goal, and we'll talk about that further, but our goal is to find it early enough when people really aren't having any symptoms at all.
Yeah, okay, so before we get to early detection and screenings, so let's say you are coughing, at what point, based off the symptoms you just named, should you be concerned? And is it something that you have to ask for specifically if you go in for, let's say, the average checkup?
I would say with general symptoms like prolonged coughing, if you've noticed weight loss or any kind of milder symptoms, I would start with seeing your primary care provider, getting a workup. Sometimes things are as general as getting started or getting evaluated with an x-ray, and then if they need to do further imaging, they will.
And screening, early detection is key for most cancers. Absolutely. So let's talk about how it impacts lung cancer and how early detection has improved over the years.
Our goal is to really push for lung cancer screening. Anybody over the age of 50 and who has a smoking history, and other, risk factors that we kind of evaluate in our clinic, we try to get them to have their annual low-dose lung cancer screening so that we can detect abnormal nodules or masses in patients, especially those that don't have any symptoms, so we can further evaluate that, because our goal is to find cancer, like I said, before patients have symptoms.
Right.
Because treatment options are so much more vast when it's found early.
So what are some of the latest advances in treatments that give those patients new options if it is detected early?
Early detection with lung cancer, patients are kind of presented with a number of options. Ideally, with early stage lung cancer, we're looking at early surgical intervention with new minimally invasive options. They have radiation treatment. There's many type of clinical trials, medications, and things that medical oncology can offer. There's so many different things that we could talk about, but it's great, and it's great that people have those options and they can choose the pathway that's kind of best for them.
Does lung cancer affect men and women differently? Even if you can't see a difference in detection, the actual physical functions, are they altered in any way?
Not necessarily. Like I said, most people that we see, men and women, are found to have lung cancer, or we end up finding that they have lung cancer many times, and people don't have symptoms. It's a lot of times the later symptoms, the prolonged coughing, unfortunately the unexplained weight loss, extreme amount of weight loss, coughing up blood, changes with your breathing pattern over time. So very non-specific symptoms that a lot of times can be something else. It doesn't always mean it's cancer, but sometimes it's something to look into further.
Now, most people associate it with smoking, of course, as you said. So let's say you don't smoke and you already think you're doing the necessary things to prevent something like lung cancer from happening. What are some other things to consider in regards to making sure you're staying healthy and in that prevention wheelhouse?
Obviously, with cancer prevention in general, making healthy choices with, diet and exercise. But there's also huge, risk factors when we talk about lung cancer specifically, like radon exposure, asbestos exposure. If you live in an older home with a basement, a lot of patients that I've spoken with have never had their house tested for radon, and that's a huge risk factor when it comes to lung cancer.
Alrighty. Well, thank you so much for joining us. Definitely appreciate your time.
Thank you.